It's a profession you might have heard about before, but probably don't exactly know what it is. Some common questions are, what exactly do they do? What can they help me with? Where do occupational therapists work? And what should I expect when working with an occupational therapist? The list of questions goes on. Well, that's what we're here to explain today. In this short video, we'll be discussing a few things like what occupational therapy involves, the broad scope of practice, and what 12 practicing OTs have to say about their profession. But first, let's start with the most common question. What is occupational therapy? Occupational therapy supports people of all abilities to engage in activities they find meaningful. Occupational therapists, or OTs as they're often known, use a whole-person approach to work with individuals, groups and communities to achieve optimal health and well-being through participation in the occupations of life. Occupational therapy is a science-informed profession that applies the most up-to-date research to support service delivery. The profession is underpinned by occupational science, which is the study of human participation in activities across the lifespan. Occupational science provides the evidence base for the clinical application of occupational therapy. Now that we've established that, what exactly does the term occupation mean? People often associate the word occupation with an individual's employment, but occupation means much more of that in the context of OT. In occupational therapy, occupations refer to the everyday activities that people do as individuals, in families, and with communities to occupy time and bring meaning and purpose to life. Occupations include things people need to, want to, and are expected to do. Occupations are usually classified within one of three broad categories. These include self-care, things like cooking, bathing, shopping; leisure, things like relaxation, sport and hobbies; and productivity, things like education, parenting and employment. Moving on now to the question of who can be an OT. Occupational therapists are qualified health professionals who have obtained a recognised undergraduate or master's entry-level degree in occupational therapy. All OTs working within Australia are required to be registered to practice and must maintain mandatory professional standards. And what exactly do OTs do? The role of an occupational therapist is to serve as a guide, helping people to establish health and life goals, and then enabling them to find the strategies, interventions, technology, and equipment that work best to get people where they want to be. Oh, just one more question, we aren't quite done yet. Where do OTs work? The scope of OT practice is broad and always evolving. This can make it difficult for people to understand and sometimes even difficult for the occupational therapist to explain. The work of OT varies from setting to setting, but is underpinned by core professional values and a holistic approach to practice. Occupational therapists work in a diverse range of roles and settings. You can find OTs working in the community, in public and private hospitals, residential facilities, people's homes, schools and universities, mental health settings, not-for-profit organisations, the corporate sector, correctional institutions, government departments, and trust me, you can find them working in a lot more places. To better help you understand the amazing scope occupational therapists work within, we interviewed 12 practicing OTs to get an understanding of where they are practicing and what their thoughts are on their profession. Meet our 12 therapists. Welcome to our first OT, Jess. Jess is a paediatric OT. Paediatric OTs work with infants, toddlers, children and adolescents to help them achieve their daily occupations, which may include things like play, self-care and school. By focusing on these key areas, OTs help children in developing a range of skills needed to meaningfully engage in these activities, including fine motor skills, gross motor skills, cognitive skills and social skills, all towards enhancing confidence, self-esteem and general well-being. When asked about the foundations of occupational therapy, Jess noted that an important part of her job is that our clients are the experts when it comes to their experiences. It is important that we acknowledge this to ensure our interventions are purposeful. When asked about the breadth of occupational therapy, Jess said, "I'm still learning every day about the application of OT and its ability to be applied across so many different contexts." When asked about what motivated Jess to be a paediatric OT, she responded with, "I didn't think I'd go into paediatric OT, having worked with adults for so long. However, my experience gave me a true appreciation and value of the importance and positive outcomes of early intervention. That's what pushed me into the paediatric domain. Jess concluded by saying she thinks OT is an amazing profession and will advocate strongly for its benefit and application of principles across all age ranges. Thanks, Jess. Moving on to OT Bronwyn now. She is a coaching OT. Coaching can be an additional qualification or an approach used in occupational therapy practice to empower and encourage a person to improve health outcomes. Let's let Bronwyn explain. Bronwyn says that when you are using this coaching approach, you're coming from very much a place of being curious, viewing the person as a whole regardless of what has happened to them. She says that they're not choosing to have limitations, but you come into their life and you don't necessarily fix anything, but help put them on the path they need to go on. According to Bronwyn, when using a coaching approach in occupational therapy, you see a whole different level of internal motivation. And just to remember that when using the coaching approach, you're not there to be the expert, but you're assuming that the person is an expert in their life. Thanks, Bronwyn. It's now time to meet OT Anna. What does it mean to be an occupational therapist in the domain of community, do you ask? Community occupational therapists work with people living in the community, enabling participation in everyday activities, resulting in maximised independence and enhanced well-being. When asked about her domain she practices within, Anna said, "Community occupational therapy is so holistic. It's not just ramps and rails. We're doing so much other stuff to help people." Thinking outside the square as a clinician is huge in community occupational therapy, and Anna quite enjoys that variation and change from day to day. When Anna was asked what she finds meaningful or joyful about her job, she responded with understanding their story, where they come from, and having appreciation for their values, their backgrounds, and their beliefs about things. It's really interesting, and as a clinician, it's something to appreciate, these intergenerational communities. We then asked Anna, what's the most rewarding thing about your job? She responded with building those relationships and connections with people who are very lonely. She finds that quite rewarding. Thanks for the info, Anna. Now we're going to hear from Charmaine, who works in the domain of academia. Charmaine is an associate lecturer in rural health community placements. In this role, the occupational therapist develops and coordinates service learning placements for nursing and allied health students on placement in rural Victoria. Service learning placements are placements where students provide much needed community services whilst gaining discipline-specific work-ready skills. We asked Charmaine what she thought the main differences were of being an OT in a rural area. She said that working rurally, there seems to be more opportunity for developing the client relationships and more building of relationships because the people you work with, you're likely to bump into at the footy club. She said what's really unique about working as an OT in a rural area is the opportunities, the opportunity to be a catalyst, to bring about change. We then asked Charmaine about her advice to students on their way to becoming OTs. She said the exciting part of being an OT is that it's so versatile and you're supporting clients to achieve their goals. As therapists, she said we are always growing and you can always reflect on what you have done. Thanks, Charmaine. On to Rehab OT Bronwyn now. Rehabilitation occupational therapists assist clients to restore their previous level of function or support clients to adapt a new one by developing practical strategies to overcome the daily challenges caused by illness, injury, recent diagnosis, or aging. Bronwyn says that working as an OT in rehabilitation is about identifying what the person wants to achieve, so sitting down and spending time with them to understand what their goals are and what their lives look like before. She said that one of the key things to working in rehabilitation is that you need to understand what the client wants to achieve and then be prepared to advocate on their behalf. To summarise, Bronwyn said we make a difference to people's lives and that we, OTs, have got so much we can add to so many different areas. Thanks for sharing an insight into Rehabilitation OT, Bronwyn. Now we're going to meet OT Nadine. Nadine is a community occupational therapist who specialises in acquired brain injury, or ABI. And ABI can result in physical, cognitive, behavioural, psychological and sensory impairments. As a community ABI therapist, Nadine works in partnership with her clients in their homes to overcome or adapt to life with these impairments and increase participation in valued life roles. We asked Nadine what type of approach she uses when treating patients. She said, "I use a very strength-based, very individualised approach, but also, if I could take it a step further, very client-directed. I will go and see a client and say, look, you're the expert on yourself. I know a bit about brain injury, so how can we do this together? She said, OTs don't say what's the matter with you. They say what matters to you. Nadine said that we can work with people with very, very complex needs where it feels like everything is difficult and their whole life is turned upside down. And sometimes she thinks as an OT, her job is to flip that and find out what they can do and focus on the positives in that. We asked Nadine, what is something important to remember when working as an ABI OT? She said, creating an individualised approach focusing on participation in meaningful activities in their home and in their community is crucial, because you can come up with the solution, but unless a person is on board and views this as their own goal, then forget it. Now from learning about ABI, we're going to move on to vision. And the OT to teach us more about this domain is Wendy. Hi Wendy. Wendy is an OT working at Vision Australia. Blindness and low vision occupational therapists work with those living with vision impairment and blindness to improve their mobility and independence to achieve the everyday occupations in their lives. Wendy said that in her domain, OTs work to help maximise the use of a person's remaining vision by using their functional vision and looking at what technology or strategies can help. She said that it's about the needs of the person, about what they want. And what's important to remember when working in Vision OT is that communication is number one. When Wendy spoke about her workplace, she said that working for Vision Australia gives you satisfaction in your work when the purpose is helping people achieve their goals. Thanks for explaining OT in the domain of vision to us, Wendy. We will keep an eye out for more info in the future. You see what we did there? Moving on, we've now reached the domain of corporate OT. Specifically, she worked in the area of occupational rehabilitation, which involves working to assist individuals in their ability to meet the functional requirements of their employment and to plan strategies for a successful return to work after an injury or illness. When asked about OT today, Karen said, you don't go in to solve people's problems anymore as an OT, you go in to work with them to help them find their own solutions without giving too many of the answers yourself. Karen said that working in the corporate domain was fast-paced. She said that was the highest challenge for me to adjust to in corporate, was every second, every minute of time, every day counted, and she had to learn to work smart and fast. She said that as an OT, you have lots of transferable skills into personal problem solving, coaching, and then understanding how people tick as well, that holistic understanding of a person. To summarise, Karen said that OTs are very skilled people and the world doesn't realise quite how skilled they are. Thanks, Karen. We agree. Over to Julia now. Julia is an OT who works in a community role within a service that applies the key worker model. A key worker model is a transdisciplinary approach to delivering intervention where the health professional and the family work together as a collaborative team to share information, knowledge and skills across discipline boundaries. Julia explains that the key worker model is amazing. It can really reduce that feeling of being overwhelmed because you have this one consistent main contact who is there to answer any questions and to work on goals with the child. She says that the key worker model she truly believes matches the occupational therapy profession, and that's because we see the child and the family as a whole. When asked about the team environment working as a key worker, OT Julia said you become a very open cross-disciplinary team and there's a lot of sharing, lots of meeting where you present different ideas, and it's not just about OT to OT. It's speechy to OT, physio to OT, so you're constantly learning and just building so many skills. We then asked Julia about the benefits of her profession, and she said there are lots of benefits for OTs in different settings. We have very different roles and we need them in lots of different settings, but I've always found most meaning from my work in the community. Thanks for identifying the collaborative nature of OT, Julia. Now we're over to discuss what being a hand therapy OT entails with Tash. Hand therapy is the art and science of rehabilitation of the upper limb. Occupational therapists specialising in hand therapy focus on rehabilitating the upper limb following an injury or disease that affects the upper limb function and engagement in occupations. Therapy focuses on maximising a person's independence with everyday living and improving their quality of life. Tash described the domain by saying hand therapy has a very strong biomedical focus. It is often based on their injury, but we do draw a lot on the client's psychosocial underpinnings, their environment. We are very much influenced by the whole person. When asked about the clients she sees working as a hand therapy OT, Tash said it's a really broad span of age groups, but typically she would see a lot of netballers and footballers with finger and wrist injuries, a lot of elderly clients with arthritis, and a lot of work-related injuries. She says that one of the best parts of her role as an OT is supporting people to achieve the goals that are meaningful to them, enabling them the satisfaction to overcome obstacles. To conclude, Tash had this advice for OT students. Make the most of all your opportunities, be present, and keep your mind open to new possibilities. Give anything a go. Great advice, Tash. Now we're over to hear from David, who is going to speak to us about working in the OT domain of communication and assistive technology. David provides clients with advice on assistive technology to help them communicate, learn, work, and participate in activities of everyday living. We asked David to explain the common difficulties that his clients would present. He said, communication-related difficulties can present with a whole lot of different kinds of conditions. Some people are born with them and some are acquired, so it's a very diverse picture. Some people can have expressive difficulties, some people have receptive difficulties, so it's figuring out what the person needs so they can communicate and advocate for themselves, and that's a really important thing. David also noted something very important to remember as an OT, and that is that communication is at the centre of every human experience. He also mentioned that a part of being an occupational therapist is appreciating the narrative of people's lives, and we are there to assist people to do or learn to do the things they need to do in their lives. It's as simple as that, but how we do it is the science of it. That's some philosophical stuff, David. We love it. Now to our final OT, Elliot. Elliot is an occupational therapist working in the mental health domain, specifically with clients experiencing homelessness. Elliot enables clients experiencing homelessness to have access to safe and affordable housing and facilitates individuals to develop skills to live independently and improve their mental health and well-being. When asked about OTs within his domain, Elliot said, "We need more OTs in this discipline because when they put these rough sleepers in a house, not only is that a multitudinous, massive environmental change for them, they don't have that skill set to live independently and to maintain a tenancy. So our role is to establish those skills, those life and living skills." Following on, Elliot said that the need for mental health OTs is continuing to grow. It will be a space that continues to be evaluated, that continues to change, but he thinks the need and the demand is something that will continue to grow at the same time. Elliot said that as OTs, the mental health knowledge is really important because it's more about understanding a person, understanding the risk factors. And if you've got a really good understanding, it's something that can transfer across different domains. When asked about a piece of advice to give to students becoming future OTs, Elliot said, "Something that has always stuck with him is the importance of the therapeutic use of self." He thinks that's one of the most important parts of OT. You can have all the assessments, but at the end of the day, if you don't use yourself and your ability to communicate with the client effectively, it's really going to impact your ability to connect with them and provide support they need and they desire. Thanks, Elliot, for that great piece of advice. And thank you to our 12 OTs for providing us an insight into the practice and breadth of OT. So what did we learn from these interviews? We learned that OTs have a really broad scope of practice, with many specialised areas of practice, but that there are some common threads that link OT across all domains of practice. These common threads we found are expertise in meaningful occupation, a holistic client-centred approach, and the importance of the therapeutic relationship. This is the magic of OT. We would like to acknowledge that this video was a collaboration between Going Rural Health, an initiative funded and supported by the Commonwealth Government, Department of Health in Canberra, through the Rural Health Multidisciplinary Training Program, and the Charles Sturt University's OT faculty, including both staff and students, and of course our 12 occupational therapists. We would like to make special mention to the 12 students who made this project happen: Caitlin Jonker, Merrin Shaw, Hannah Cowley, Callie Morrison, Megan Luke, Chloe Frost, Hannah Sanders, Tegan Peel, Sarah Knight, Sophie Bevan, Sarah Primrose, and Sork Chem. Thank you, and we look forward to you joining us on a Going Rural Health placement to explore the magic of OT.